Yeah. So, good evening, everyone. I'm Saranjeevi Rangaraj. I'm a PhD scholar in the Department of Biochemistry, University of Hyderabad. Also, I'm a Prime Minister Research Fellow. To fulfill my teaching hours, I have been associated with this NPTL for the last 2 years. And today we are going to see week 4 lecture on immunology. So, let me share the PPT. Yeah. So, am I audible? Should I start?
Yeah,
Yeah,
start,
start,
sir.
sir. So, my PPT is also visible, right?
Yes,
Yes,
sir.
sir. Yeah, thank you so much. So we are in week 4, and we are going to see how interferons, cytokines plays a major role in immunology. So the course I have been associated with is NOC 25BT21. That is nothing but host pathogen interaction. So as usual, the agenda for the day is we'll do some recap on week 4 concepts and the practice questions. Then the doubt clearing session we are going to do. So far, we have started with history in the first week. Then we have talked about cells and organs of the immune system. And today we are going to see the cytokines. Okay. So cytokines, uh, majorly, if you see, if you want to put it in a layman term, every time every organ should talk to each other. Okay. And sometimes we know that some pathogen will be there in the brain, some pathogen there will be there in the leg, some pathogen will be there in the nail. So our immune system from the which is in the circulating form should go and attack the certain pathogen or invaders to clear those things, and it should not be done with the what do you say, for example, in a normal case 10 police people are there. Police in the sense immune cells are there in the site of infection. Okay, but only the 10 people cannot stop the 100 invaders. In this case, we are talking about pathogen or bacteria or virus. Okay, so we need more police. So maybe 1,000 or 2,000 to kill this 100 pathogen. So for that, the site of infection wherever it happens, from there certain molecules will be synthesized. Basically, those can be protein molecule or it can be the glycoprotein molecule. Okay, will be secreted out of the cell. Here we are talking about immune cell. Some cases non-immune cells also secrete. So those proteinaceous or glycoprotein molecules are called as cytokines. Okay, so that is what we are going to see, how to recruit more number of cells or to differentiate the cells into a matured phase or the attacking phase, how the cytokines are going to act. So that is what the whole lecture that we are going to see in the week 4. Okay, so by definition, if you see, the group of proteins which facilitate cell to cell communication or interaction for the development and then immune responses are called as cytokines. Here we are talking about immune cells in particular, but non-immune cells also can be can secrete this cytokines in day-to-day life. So how these cytokines work? So there should be any mode of action should be there. Now, for example, if you take some kind of sponge, then if you pour water, the water will be absorbed inside the sponge, right? Like that, any molecule should act in a certain way. So it can exert its effect in the three different ways. One is it can act as an endocrine molecule, or it can act as a paracrine, or it can act as an autocrine. So we'll start with autocrine, then we will understand one by one. So I'm talking about this third one, which is a Autocrine. Autocrine is nothing but a molecule will be synthesized by the same cell. For example, here one molecule is synthesized. So that molecule will acted upon the same. It's like that you are cooking for yourself and then you are eating. Okay. So that is why it is called as an autocrine signal, because until you eat food, you will be not having any energy. So once you eat food, then you will be energized. So the same way, autocrine is nothing but the cell is making cytokine for its own benefit. Okay. Or it can kill the cells also. It based upon the cytokine it secretes. Then the paracrine. Paracrine is nothing but in your home you are cooking the food and then you are delivering it to the neighboring home because they want it, they didn't cook or something, so you are giving it to them. So same way, paracrine is nothing but A cell is secreting certain cytokines that will be given to the B cells. Okay, here it's an endocrine system. Third, I'm talking about, in which is here it is first. So this endocrine system is nothing but you are sending that food material to the person who is not in your village or not in your district. So you are giving it to the other person. For really good example, we can take it as a Zomato. So somewhere another village that shop is there, you are getting the ordering the food, then it is coming. So in the same way, endocrine system is somewhere it is produced, then it will be delivered to the other way through the circulation system. So that is called endocrine system. Okay. So here for example, endocrine, usually we talk about the um, pituitary gland, which is present near the inside the brain. Then it will secrete certain hormones, then it will circulate, then it will go to the thyroid, or it can got into the parathyroid glands, or it can go into the adrenaline gland, pancreas. So those kind of things. Here I'm giving it as an example, that endocrine system. So that also exists in the cytokine, people are saying, but majorly the common two things are autocrine as well as paracrine manner of action is most common. Okay, the second and third are more common. Understood? Should I repeat it, or it understood?
Understood, sir.
Okay. So if you see there, one great example, if anyone asking any exam, which cytokine acts in the three modes, like endocrine, paracrine, or autocrine mode, that is IL-2. So IL-2 is having all the three modes of action that we talked about. What is that? Endocrine, paracrine, and autocrine. Okay. Next, so far we have talked about the immune cell, everything it will happen. It can also happen in the non-immune function as well. Immune function means that clearing the pathogen or attacking the pathogen, those kind of things, the immune function. Non-immune function, if you see, cytokines such as IL-8, okay, and then that is called interleukin 8, or MCP1, that is called monocyte chemotactic protein. So chemotactic means, chemo means some chemical molecules, static means attracting. So it will attract the monocyte to the site, or involved in the follicular development and atraxia, ovulation, steroidogenesis, and corpus luteum function. Okay. And the adrenal cortex and then adrenal cortical and chromaffin cells produce the cytokines such as IL-1, IL-6, TNF alpha, leukemia inhibitory factor, that is called LIAF, and IL-18, which have a key role in the adrenocortical communication. Okay. So the properties of cytokines, if you see, majorly these are very low molecular weight regulatory protein, or glycoprotein we say. Glycoprotein is nothing but one protein molecule will be there. Proteins are made up of what? Proteins are made up of, what is the building block of protein? Someone answer.
Amino acid, sir.
Yes, amino acids. Good. So it's certain amino acids can be phosphorylated or glycosylated. Okay, there are two glycosylation that we talk, that is the N-linked glycosylation, another one is O-linked glycosylation. Okay, so the glycogen molecule, glyco in the sense, here we usually talk about carbohydrates. Okay, so that can be attached on the amino acid. N-linked means asparagine is involved. O-linked means serine is involved. Okay, because serine has one OH group, so there this H molecule will be replaced by the any other carbohydrate molecule. Okay, N-acetyl glucosamine or multiple galactose, glucose, those can become an glycol, glycosylated on the surface of the protein. And asparagine also another example for the, if asparagine molecule here is there in this protein molecule, so it can become the glycoprotein. So it will remove the amino group, then it will go and attach. Okay, this is the first property. So what is the property? The cytokine can be the low molecular weight, A, and it is a regulatory protein, or it can be a regulatory glycoprotein. Okay, second one, secreted by WBC, which means white blood cells, that we have talked in the last week. If you go back and then see, we talked about monocyte, macrophages, lymphocytes, B lymphocytes, T lymphocyte, mast cells. So multiple cells that we have talked in the last week lecture. So if you go back and then read, you will get to know what are WBC. That is nothing but white blood cells. So which is a low molecular regulatory protein in response to intrinsic extrinsic stimuli. What is the meaning of intrinsic and extrinsic stimuli? Is that just okay? Um, So intrinsic stimuli is nothing but it's inside the body. So body is giving any kind of stimuli. For example, you have taken some knife and then you cut your finger or something. Okay, so it's an intrinsic stimuli. Your body is cut somewhere in your skin or something. So that is giving some kind of stimulate to the body. It has to be healed. So bring the cells to heal it. Like for example, platelets or blood clotting factors, it should come to the place. So it's an intrinsic stimuli, we can say. Extrinsic stimuli is multiple things are there. Some people are having allergic to the food. Some people are allergic to some kind of pollen grains. So those kind of things are there as an extrinsic stimuli. Uh, Extrinsic stimuli can be virus, pathogen, those kind of things also, because it's coming out of the body. So this is a third property. And then cytokine's actions is short lived, generally ranging from few hours to few days. So what is the thing? Third property, it's very short lived. For example, if I'm giving it for the cytokines to anybody, it can be excreted or it can be denatured within some few hours to few days. So this is the third property. And fourth property is what? Cytokines regulate the intensity and duration of the immune response. So if the more cytokines are secreted, then the more immune response will be active. Okay, so what is the overall thing? First, we can say first one is it's a low molecular weight regulatory protein, or it can be a glycoprotein. That's the first thing. Second one is it's secreted by WBC, and third one is it, in the response to what response it will get, it can be the intrinsic response or it can be the extrinsic stimuli. So two stimuli should be there. Any kind of stimuli it is there, then it can be secreted. And the fourth is what? It is short lived basically. Correct, it is short lived and generally ranging from few hours to few days. So this is the fifth point. And finally, what is the sixth point? Cytokines can regulate intensity as well as the duration of the immune response. So which means 6 points are there for the cytokine. So this you should remember. Whosoever asks, you should know this kind of thing, what is happening as a if a cytokine is there, what kind of function it does. If you read this thing, then rest of the slides are very easy. So this is what we have talked about in the last slide, how it is happening. But here the cytokine action can be in a multiple way. So there are five kind of activities are there. First one is pleiotrophy. Pleiotrophy is nothing but one cell is secreting one set of cytokine. Here activated Th cells. Th cells are nothing but T helper cells, right? T helper cells will have which CD molecule, CD receptor, C. D receptor, which number will come in T helper cells? We have seen in the last week. T helper cells has which CD marker? This you people study usually in HIV and everything. Which cells? Have you studied about CD4 and CD8 cells? Yes or no? If you tell me, then I can tell you according to that. Yes or no?
Yes, sir.
Yes. So T helper cells are having CD4 receptor. Okay. So it can secrete the IL-4, which is an interleukin 4 system. So here, if you see, what is the phenomena for pleiotrophy? One molecule can act upon different cells, so it can go and activate different cells. Okay, that is why it is called pleiotrophic effect. So one molecule can go and activate multiple cells, A cell, B cell and 3 cell, C cell. That this is called pleiotrophic effect. So one molecule from one system, here what is activated TH cells, which can activate the B cell or the thymocyte or the mast cells, so which will become pleiotropic effect. So what will happen, the effect, if you see IL-4 activates B cells, what will happen? It will activate the B cell, it will proliferate the B cell, and then it will help in the differentiation. Okay. In the same way, if it goes and binds to the receptor in thymocyte, it will help in the proliferation. Same will happen in the proliferation of mast cells. Understood? Second property that we are going to see how it will do the action. Second one is the redundancy. Redundancy is nothing but different cytokines. Okay, here IL-2, IL-4, IL-5 all are helpful in the case of B cell proliferation. So the action or whatever the outcome we are seeing is the same, whether it can be the IL-2, whether it can be IL-4, whether it can be IL-5. So this is called redundancy in the cytokine action. The redundancy we have studied somewhere else. Do you people remember where you people have studied? Not in the immunology. I feel that you people have studied in molecular biology. Redundancy. This word you people should have studied. Do you remember where you have studied? Any thoughts? There is something called genetic code. Have you studied? Genetic code. Yes or no? Have you studied in molecular
No.
biology? Genetic code you have studied now. How many genetic codes are there? 64. Okay, in that 61 are coding and then 61 are, so another 3 are, these are sense and these are nonsense genetic codes. Okay, so these are stop codons we say. Okay, so this 61 is coding around 20 amino acids, right? So that's why more than one code can produce more than one amino acid. So that's why it is called, so more, yeah, multiple codons can produce one single amino acid. That's why it's called as a redundancy. So the redundancy we have seen it in the genetic code as well. If you go back and then read your molecular biology thing. So this is the second phenomena. So first one is pleiotrophy. Pleiotrophy is what? One cytokine can go and act on the multiple cells. Redundancy is multiple cytokines will do the same function. So multiple cytokines here what? IL-2, 4 and 5, which help in the B cell proliferation. Okay. And third one is a synergy. Synergism is nothing but two things together will activate one action. So what is here? Activated TH cells are secreting IL-4 and IL-5 that helps in the B cell to switch the class, that is from IgM to IgE. So this class switching we will study it in the whenever we study about B cell and then the B cell development and the immunoglobulins. Now, right now don't confuse it. There are 5 classes of immunoglobulins: IgM, IgE, IgG, IgD, and IgA. Okay, so all immunoglobulins will be synthesized in the case of class switching, except IgM. IgM is always present first. So we will see how this class switching will happen and what are the mechanisms are there in the upcoming classes. So far, there are three kind of actions that we have seen. That is a pleiotrophy, redundancy, and then the synergy. Okay. And fourth one is antagonism. Antagonism is what? If IL-4 is helping in the class switching, but IF and gamma from the same cell, that is activated TH cells, will inhibit the function of IL-4. So that is called antagonism. So here what is happening? IL-4 is helping the class switching, but IF and gamma stop the class switching. So this is called antagonism. So it works opposite way of IL-4. That's what it's called, antagonism. And next function is we can say as cascade induction. Cascade induction is what? One cell will activate another cell. For example, here T helper cells is activating the macrophage by producing the IFN gamma. Then this macrophage secrete the IL-12, interleukin 12, that will go and activate the other TH cells to produce IFN gamma, TNF, IL-2, and then other cytokines. So which is called cascade induction. Cascade induction is what? A cell will secrete some molecule that will affect the B cell. So B cell will secrete some molecule that will acted upon by the C cell, and C cells will secrete certain molecules. Okay, then so on it will continue. So this is called cascade induction. So what are the five properties that we have seen? One is a pleiotrophy, redundancy, synergy, and antagonism, and finally the cascade induction. Understood? Should I go to the next topic?
Yes, sir.
So do you have any doubt here? What is pleiotrophy, synergy, redundancy? No, na?
No, sir. No.
Okay, next one. So next one is how this cytokines are named actually. So how they got their name, or what is the nomenclature, or how they are categorized. Okay. So naming the cytokines based upon the where it's secreted. So for example here, lymphokines we say because it's secreted from lymphocytes, and monokines means it's secreted from monocytes or the macrophages, and interleukin means it's usually secreted by the leukocytes. Okay, so some are named as a common name, which is for example here we are given TNF, that is called tumor necrosis factor. And what we have seen, the chemokines, whatever it's there, it's other set of type, how they have named this thing. These are also low molecular weight cytokines that affect the chemotaxis and other aspect of leukocyte behavior. Chemokines means it will secrete, suppose some cell is there, it secretes some molecule. Okay, then it is attracting the B cell. B cell in the sense some A and B, I'm saying, I'm not talking about B lymphocyte. B cells will come here. If somewhere in the body, it will come to the site of infection. So more B cells will be there, then it will clear the pathogen. So this is called chemokines. So which is helping in the chemotaxis. Chemotaxis means movement of the cell. Okay, so to the particular place. So other cytokine types, if you see, based on the source cell, maybe it is innate or in the adaptive immune cells, or based on the function that we see, that we will say pro and anti-inflammatory cytokine. Okay. So cytokine function, what it is exactly? It is helping in the cellular and then the humoral immune response. That is the first function. Second one is it used or it helps in the induction of the inflammatory response. That is the second one. And third one is regulation of hematopoiesis. Hematopoiesis means what? Poiesis means what? Synthesis. Okay, synthesis of blood cells. Okay, and then control of cellular proliferation and then the differentiation, that is the fourth point. And fifth point is the healing of wound. That is what I said, somewhere some wound is there in your hand, but cells will come and then attack the pathogen, or it will swell, then it will heal. So these are the five properties of cytokine. First one is it helps in the development of the cellular and in the humoral response. Development means what? That I told you now IgM to IgE class switching, those kind of things are development phase. And induction of the inflammatory response, which means whenever any cut is there, then the hand or the place of infection will be inflamed. So that is called induction of inflammatory response. Third one is regulation of hematopoiesis, so synthesis of new blood cells. And fourth one is control of cellular proliferation. Proliferation means what? One cell will become multiple cells by cell division. It's called proliferation. And differentiation also. What is the differentiation? Here the round cell is there. That round cell will become square shape. The one great example is monocyte to macrophage. Okay, so far we have seen how cytokine is functioning and everything. But if any infection is there from any kind of bacteria or virus, it should correlate, right? It should not affect much. So there are certain viruses in nature. They are having the homologue of these things. Homologue means what? The same structure or the similar structure, almost 80% structure or 70% structure will be similar. So that will stop this kind of cytokine function. For example, one such example is Epstein-Barr virus, which is a cytomegalovirus as well. These two are having IL-10 homologue. Homologue means not the exact protein. It will be some or other way exactly similar to that protein will be there. So what will happen? Then the IL-10, instead of IL-10, it goes and binds to the IL-10 receptor. Then the IL-10 activity will be blocked. Okay. Second one, vaccinia virus and then variola virus as soluble IL-1 receptors. Then it will neutralize the IL-1 activity. Okay. Same myxoma virus, that is also having the IFN gamma receptor. So which will stop the IFN gamma activity. Okay, variola virus also, that also having the soluble TNF receptor, and adenovirus which is having RAD complex proteins induce the internalization of the FAST receptor. FAST receptors will come in the apoptosis signal. And measles virus will have viral hemagglutinin binds to the complement receptor CD46, signaling disruption of the IL-12 production and therefore inhibition of Th1 pathway differentiation. And the herpes simplex virus reverses the translation block induced by typhoon interferons. And adenovirus, and again it is having blocks the interferon induced JAK-STAT signaling. So this is what we have seen so far. The cytokine function we have seen, cytokine how they are named, and then the what are the different actions. Then finally, what are the viruses are having the homologue, or how viruses will stop the action of this cytokines that we have seen. So next we will see what is the action and then the function, how it is doing. So each and everything we exampled. For example, here you see eosinophil is there, which is in the downside I'm highlighting. So IL-6 is acting upon the same thing. What is the meaning for this thing? We have seen three things: endocrine, paracrine, and autocrine. What is an example? Here eosinophil is there. IL-6 is produced from eosinophil and it is acted upon, it's acting on eosinophil itself. So what is an example? Three things that we talk. One is a paracrine, autocrine, and endocrine. So it's an example of one. It's an example of autocrine. Very good. And this one, this T cell is there. T cell is helping on neutrophils. What is this? What is an example? It's a paracrine or endocrine? T cell is secreting something, IL-1 or IFN gamma and everything. So it helps the neutrophil, which is an example of paracrine, autocrine, or endocrine. Paracrine. Okay, so the same way we have seen how the redundancy is working and the synergism, those kind of things also you can see it in this thing, multiple uh, cytokines are working on multiple cells. So that's what we are seeing the overall. So here also macrophage is secreting certain things. It's acted upon by the same cell, or it is secreting the other cell, other type of IL-1, IL-8. Then it is acting upon the basophil, or it's secreting the IL-10, and again it is working on the some other cells. So these are the overall action. There is no need of you to remember all those thing. What are the cytokines are there? How it is happening? Overall, I think when you read multiple papers on cytokines or the multiple papers on the immunology thing, then this will be remembered on your head. So don't put that much stress to remember this many things. Okay. So we are going to see next set of categorization. So far we have seen the name wise and then the action wise that we have seen. Now how in the case of innate immunity or if it is work in the adaptive immunity that we are going to see. The first one we are seeing that is the interleukin 1, that is nothing but called IL-1 cells. So that is can be secreted by monocytes, macrophages, endothelial cells, epithelial cells. So what will happen? It helps in the vasculature, such as the inflammation, hypothalamus. It can induce the fever. So what is inducing the fever here? IL-1 can induce the fever, and the liver induction of acute phase protein. So those kind of things can be done by the IL-1. What is tumor necrosis factor is doing? Tumor necrosis factors can be synthesized by the macrophages, monocytes, neutrophils, activated T cells, or the NK cells. So what it does, it also does the same, more or less same function like the IL-1. It helps in the inflammation, induction of acute phase proteins, and then loss of muscle, body fat, which is called cachexia, and then the induction of death in many cell types and neutrophil activation. And there is a third type of one is IL-12, that is secreted by macrophages as well as the dendritic cells. So that goes and activates the NK cells, influences the adaptive immunity that promotes the Th1 subset. And IL-6, which is the macrophages and endothelial cells, and then the Th2 cells also can synthesize. Endothelial cells are not immune cells, but if you see those things also secreting the IL-6. So what it does liver to produce the acute phase proteins and then influence the adaptive immunity, proliferation, and then antibody secretion of B cell lineage. And the interferon alpha, this is a family of molecules that can be secreted by macrophages, dendritic cells, and virus infected cells. So how what it does, it induces an active antiviral state in the most nucleated cells, increases the MH1 class 1 expression. So we know most of the nucleated cells express MHC class 1 molecule. And interferon beta, so that can be secreted by macrophages, dendritic cells, and virus infected cells, which can induce as an antiviral state, same like IFN alpha. Then increases the MH class 1 expression and activates the NK cells. So that is the second. First one we have seen innate immunity. Next one is an adaptive immunity. Adaptive immunity can be so here one important thing people can ask you multiple times in any exam. This IL-1 that will induce fever. So if any exam they are asking which cytokine is responsible for inducing fever. So which one you have to choose? IL-1, right? So that is the really important one more question in any exam. Okay. And here adaptive immunity, that is IL-2, that's otherwise called interleukin 2. So T cells can synthesize this one, and which helps in the T cell proliferation, can promote the AACD, NK cell activation, proliferation, and B cell proliferation. And second one is IL-4, and which can be secreted by Th2 cells as well as the mast cells, that promotes the Th2 differentiation, isotype switch to IgE. This is what I said. We will see it in the upcoming classes. What is class switching? And the interleukin 5 can be secreted by Th2 cells, and which helps in the eosinophil activation and then the generation. And TGF beta, that is called transforming growth factor beta, that can be secreted by T cells, macrophages, and other cell types. This helps in the inhibition of T cell proliferation, effector function, inhibits the B cell proliferation, promotes the isotype switch to IgA, and inhibits the macrophage. Have you studied what is the difference between IgE and IgA? IgA seen in where normally? One example you give me. Immunoglobulin A usually seen in which part of the body or where it can? Colostrum. Other than that, when you cry, which antibody will be there in the tears? If you cry, so which
IG,
antibodies will come in the tears? Huh?
IG, IgA.
IgA. Yeah. So IgE, mostly people have seen in which one? Which condition IgE will be secreted more? What? Allergy. Yes. So in allergy case, IgE will secreted more, and IgD is there, IgM is there, and IG G is there. Okay, we'll see different classes when we are talking the respective topics. Then interferon gamma. So that is having that can be synthesized by or secreted by Th1 cells and CD8 positive cells and the NK cells. So that helps in the activates the macrophage, increase the expression of MH class 1 as well as the class 2 molecules, and increase in the antigen presentation. This we will see whenever we talk about MHC presentation. Okay. Okay. Not only these molecules that we have seen, there are other molecules which is non-proteinaceous or other set of things can be helped as immune mediators. One such thing or two things that we talk here is histamine as well as the serotonin. Okay. So the serotonin is present in the hematopoietic stem cells and high abundance in the platelets. Okay, serotonin regulates the inflammation and immunity by acting on the serotonin receptor that are differentially expressed on immune cells, not on the non-immune cells that you should understand. So it acts on immune cells only. And serotonin acts as a potent chemoattractant. So when the any cell is secreting the serotonin, then it will recruit the innate immune cells to the site of inflammation. Then finally, serotonin alters the production and release of other cytokines and cell activation and then the proliferation. So these are function of the serotonin we can say. And finally, immune cells including the mast cells and T lymphocytes have the capacity to synthesize and release the serotonin. And histamine we have seen already in the last class. What will happen? Histamine can be synthesized by or the released whenever the degranulation of mast cell takes place. Okay, so that time all histamine will be synthesized that can go and affect on the smooth muscle, small blood vessel, mucus gland, blood platelets, and sensory nerve, and it's an eosinophil. So these are the different action of this histamine. Okay. And other than these two things, we are having the thromboxanes, leukotrienes, and prostaglandins. How these things are usually synthesized? Whenever in the membrane, in the cellular membrane, if you see, some lipid molecules will be there. Okay, so the membrane phospholipid, by the action of this phospholipase A2, that will remove the fatty acid, whichever in the second position of triacylglycerol or here in the phospholipid case, then it will be removed here. Then it can synthesize the arachidonic acid, which is a carbon 20 molecule. From the arachidonic acid, it can synthesize the prostaglandin, E1, thromboxane, and leukotriene. So that will help in the that will act as a immune mediators. So if you see this involved, whatever that we have talked about, this icosanoids that is involved in the reproductive function, in the inflammation, fever, pain associated with injury or disease, or formation of the blood clots, and then regulation of blood pressure, as well as in the gastric acid secretion. These are used. So if you see, there will be two enzymes, that is COX1 and then the COX2, which we call it as a cyclooxygenase, can be inhibited by the non-steroidal anti-inflammatory drugs. Okay, non-steroidal anti-inflammatory including aspirin and ibuprofen. The two drugs are there. So one is aspirin, then ibuprofen will inhibit the cyclooxygenase. Okay, so what it does, if this is the aspirin, you know na, we all take it whenever we are having any kind of over inflammation or any kind of reaction, we take aspirin. What will do, aspirin goes and inhibit the cyclooxygenase 1 and 2. Then this action of leukotriene thromboxane will be, or prostaglandin will be stopped, then there will not be more inflammation occurs. Okay, then one more thing, that is a bradykinin, which is a peptide which is having 9 amino acids. So which means 1, 2, 3, 4, 5, 6, 8, and 9. So 9 amino acids peptide is bradykinin. Okay, so which helps in the blood pressure regulation. Hello, what happened? Am I audible?
Yeah, yes, sir.
Yeah, yes, sir. Yeah. So this a bradykinin is a peptide molecule, so which is having 9 amino acids basically. So which plays an important role in the blood pressure regulation. Acts as a vasodilator. Then it plays an important role in the inflammatory reactions and elevate the vascular permeability to cause the vasodilation in some arteries and in the veins. Okay. And other than this thing, there are some proteins molecules will be there. That is a fragment of complement such as C3A and C5A that we have already talked how it will helpful in the this case. So these protein molecules such as cytokines, that is IL-1 beta and then IL-6 and TNF alpha, are proteinaceous molecule that can activate this complement pathway. What the complement pathway will do, it will form the complex called membrane attack complex. Then it will cause the pores in the pathogen membrane. Then it will kill. So that we will see it whenever the complement topic comes. Okay. Then second one is type 1 interferons, which is the family of proteins having the 13 members and single IFN beta. That is the type 1 interferon. And this type 1 interferons induce certain genes, that is nothing but IP10 and RANTES. RANTES is nothing but CCL5. It's a ligand for CCR5 receptor. And type 3 interferons, so which is nothing but interferon gamma, consists of 3 members. Okay. So next topic that he talked about is inflammation. So far you people understood. Can I move on to the next thing? So far we have seen what are the different cytokines and how are they act, and then how do they act. Then what else we have seen? Their different nomenclature and then types, those things. And immune mediators also we have seen, which is not a, uh protein molecules or glycoprotein molecules. So that is what we have seen. So can I shift it to the next topic, which is called inflammation? Should I start this topic?
Yes, sir.
Yes, sir. Okay. So inflammation, if you see, it's an evolutionarily conserved process that characterized by the activation of immune and as well as non-immune cells that protect the host from bacteria, virus, or toxins and infection by eliminating the pathogens and promoting tissue repair and then the recovery. So inflammation is an evolutionary process. It has been there, and then it's very conserved process, not only in our cells as well as the other mammals also it is there. So that's why we call it as a conserved process. So through, if you see, it's immune and then as well as the non-immune cells are involved. So what it does, it will eliminate these pathogens, what is called bacteria, viruses, or toxins or infections. So how it happens, if you see, any kind of infection is there in the body. Okay. For example, you got any kind of flu or influenza virus in our body, or pathogen like bacteria. So any infection comes, then the cellular and then the molecular factors from traumatized or stressed cell or tissues will be secreted. So this is nothing but we call it as cytokines. So these cytokines can activate the innate immunity, okay, or once the innate immunity starts, then it directly goes to the inflammatory state. Or the cytokines also enhance the cells nearby or the neighboring cells, then it can cause the inflammation. But inflammation outcome can be multiple ways. One, first thing is it will eliminate the pathogen, but if it is prolonged thing is there, then it can cause uh, disease state. Okay, so that's what we are going to see. What are the disease state, or what will happen this inflammation thing is not occurring, or what will happen if the inflammation thing still occurs, but if it clears the pathogen. That's what we are going to see. So this inflammation, it's not the first like recent phenomena that people are studying. It was founded by the Roman physicians, which was Cornelius Celsus. He belongs to first century AD. So what he, this is the person who is in the left side. So he described this inflammation in his own words. That is a rubor, a tumor, cum calori, and dolori. Like that, he said. What is the meaning in the English? That is redness. Rubor means redness. Tumor means swelling. Calorie means heat, or in the dolori, that is pain. So this is called Celsus tetrad inflammation. And recently, that Rudolf Virchow, after him, after several years, he said that he added one more thing. That is the fifth phenomena of inflammation is disturbance of function. That function plasia. So that is a fifth phenomena. So there are five phenomena for this inflammation. Either two can occur or three can occur, then still we can say it as an inflammation. First one is there should be the redness. This you can see any inflammation comes, any swelling comes in your thing, those all things will come. Redness will be there, swelling will be there. What happened? Swelling will be there. Sometimes we'll get fever or the what are the infected place. Sorry, I will connect it to my 2 minutes with me. So these are the five phenomena that we are saying. One is the heat. Okay, this is a nice cartoon picture, so you can easily remember. So first one is it should be a heat generating or rubor, that is the redness. If you see his face is red, then the swelling, that is a tumor, and then the dolor. Dolor means pain. Then finally the loss of function will be there. So this is the all phenomena is called as inflammation. Okay. And what will happen whenever any kind of inflammation happens? Here, if you see, the blood line will be the artery or whatever the vein is there, it will be narrowed down. When the narrow downing is happening, that capillary widening will happen. Then the increased permeability of the cells will be there. Then, without any damage, that extravasation of the nuclear neutrophils will take place. Then it will secrete the certain response or the proliferation, or in the case of cytokine secretion will be there. Then it finally causes the dense material to pack here. Then it causes the pain. So what will happen whenever the tissue injury caused by the physical or the chemical agent or the pathogenic microorganism? First, it's a capillary widening will takes place. So that will increase the blood flow. So the increased blood flow will cause heat. Then there will be certain increased permeability where will be there, that will cause the fluid release into the tissue, that causes redness as well as the swelling. Then the extravasation of the leukocytes will take place to the site of the injury. Then it causes the tenderness, and finally the pain will be there because of the fever and then the proliferation of the leukocytes at the site of infection. So this is called different uh, phenomena of inflammation. Okay, so what it happens, any kind of inflammation in the homeostasis, this is a normal phenomena, but multiple ways it can happen. First one is inflammation occurs, then the homeostasis should be there, because after the inflammation it should come back to the normal stage. So this is a normal level of your body pain. Then the homeostatic stage, it can go like this and it can come like this. Okay, so it can go to the extremes of that. Then the homeostatic stage, it has to come back to this thing. If any perturbation happens during the physiological inflammation, then the more level of homeostasis disturbance will be there. So this is quite easy because it's a physiological inflammation. In the case of anything, for example, any seed you have eaten that cause any kind of inflammation, and once it's got excreted, then we will come back to normal. So that is called easy to bring back. But in the pathological inflammation, in the sense, it causes a more inflammatory state, like increased cytokine production is there, increased activity of immune cells are there, then it causes the pathological inflammation. So this elimination is hampered. So this is called persistence of inflammatory inducer, and then this inflammation enhances the inflammation. So here we are going to see certain things. Any cause of inflammation, then what is the impact on the physiology? If it is not clear, then what is the pathological outcome we are going to see. Okay. So if this is whatever the green color is, if the pathogen clear, or if it is not clear, then what will be the pathological outcome? So for example, the cause of inflammation is microbial infection is there. Okay. Then the pathogen clearance will be there. If it is not cleared, if it is still there in the body, what will happen? Sepsis will happen, tissue damage will happen, and may result to the autoimmune disorder. One such disorder that we always talked about, rheumatoid arthritis. Okay. And second one is the cause of inflammation can be unfavorable living items or the non-living entities. This is what we have talked about. Any kind of cement or plastic material, plastic particles, pollen grains, those kind of things also can cause the inflammation. So the clearance of living and then the non-living entities, the final impact on the physiology. Or else if it stays for so long, then it can cause the allergy as well as the anaphylaxis. Okay. And if the tissue injury is there, tissue injury is what something is some knife or something it made the tissue injury, then the impact on the physiology is tissue repair will happen, then the inflammation occurs. Suppose that the inflammation doesn't occur, then it really issue is coming, then the tissue fibrosis, which may result to the cancer as well. Then the loss of homeostasis that we have talked about in the last slide, that intrinsic extrinsic factors will be there, that leads to the adaptation to stress or the restoration of the homeostasis. So this will relate to the homeostasis associated disease such as the heart failure and then the diabetes. Okay. So sterile inflammation is something different, which is we have not talked about in the last. These are the not factors. If other factors like any other biological factor or social physiological factor, for example, you are stressed because of your work or your studies, and the pollution is there in your area, in terms of the environmental factor, that can also cause the inflammation in your body, and prolonged stress because of this thing, what will happen, some people will get this homeostasis associated disease called heart failure and then the diabetes. That's why we say the way we live life without stress, and then the way we take food, that is also matters in a really thing, because the any kind of person can get without irrespective of their age and then the gender, they can get this heart failure as well as the diabetes. So then the final type that we talk about, we are going to talk, that is pro-inflammatory cytokines as well as the anti-inflammatory. So the pro-inflammatory cytokines are much. One is IL-1 alpha, that is called interleukin 1 alpha, which initiates the self-perpetuating inflammatory response, which induces the fever and then the vasoconstriction. So that we have seen from the last slide. IL-1 we have seen it from the first slide, and IL-1 beta. This also helps in the self-perpetuating inflammatory response, and which also induces the fever as well as the vasodilation. So if you see here, both are two different things. One is you're helping the vasoconstriction, another one is the vasodilation. So IL-1 alpha and IL-1 beta are quite different. And another one is IL-6, interleukin 6, which induces acute phase protein secretion, T and B cell growth as well as the maturation. And IL-8, which recruits the neutrophil to site of infection. And IL-12, which is interleukin 12, which promotes the differentiation of naive T cells into Th1 and blocks the angiogenesis and then activates the cytotoxic T cells. Then other cells also, TNF alpha is there, which helps us promotes the leukocyte extravasation and induces the fever, and then the promotes the vasodilation. And INF gamma, that is this IFN interferon. IFN gamma activates the cytotoxic T cells, macrophages, upregulates MHC2 expression in macrophages. And MCP1, which is called monocyte chemoattractant protein 1, which is involved in the monocyte trafficking, recruits the monocytes, macrophages, and NK cells. And finally, we have talked about GM-CSF in the last classes, which is called granulocyte macrophage colony stimulating factor, which helps this PBMC to become certain cell line. It will mature. So, but here if you see, it will give the it will become dendritic cells here if you grow it in the cell culture thing from the PBMC. But here if you see, it stimulates the monocytic cells, promote their survival and then the differentiation. So how the mechanism of pain will happen? Any kind of TNF alpha and then IL-1 beta, IL-6 and then MCP-1 is secreted that directly modulate the neuronal activity in the brain, and then from the brain some central and the peripheral nervous system will be attached. Then the spontaneous activity evoked for nociceptive neurons. So this nociceptive neurons are helpful in the case of inducing pain. So you will feel it now, oh my god, I'm getting so much of pain or something. So that is due to this kind of reaction only. First, these cytokines will be activated, then it's directly modulate a certain neuronal activity, then it affects the central and then peripheral neural activity, then it activates a certain neurons called nociceptive neurons. That causes the pain feeling. Understood? Then there are inflammation also divided into two types. One, it can be the acute inflammation as well as the chronic or the systematic chronic inflammation. So we know the difference between acute and then chronic. Last class also we have discussed. Acute means the severe reaction which happens in the short term of duration. For example, if this is the case, within the 0 to 5 days, there will be so much of reaction will be there. But chronic inflammation is you will not see that much of response, but it is prolonged. It can be months to years. That's why it is called as chronic inflammation. So the two examples you see, the trigger can be in acute phase, it's PAMS, that is the pathogen associated molecular patterns in case of or the DAMS, that is associated molecular patterns, that is cellular stress or in case of trauma. Here, if you see, the systematic chronic inflammation is DAMS, that is exposome, metabolic dysfunction, and tissue damage. And duration is short term, that I have already talked here, but it's a chronic means it's a persistent and then a non-resolving. And magnitude is which is high grade, that is what I have told it in this diagram, and low grade is for this because it is prolonged, then it's not that much magnitude it has. And outcomes is healing, trigger removal, and then the tissue repair. But this systematic chronic inflammation will have collateral damage. And age related, it is not, but this systematic chronic inflammation is it's age related. And biomarkers for acute inflammation is it includes IL-6, TNF alpha, IL-1 beta, and then the CRP. CRP is nothing but it's a C-reactive protein. Whenever you have any kind of infection or something, doctor will first suggest the C-reactive protein because acute inflammation, the C-reactive protein will go up. Okay, but here if you see in the systematic chronic inflammation, which is very silent, we don't have any kind of canonical standard biomarkers to say this thing. It is chronic inflammation. So the causes and consequence of this low-grade systematic chronic inflammation includes it leads to obesity, dysbiosis, diet, isolation, and then the chronic stress, disturbed sleep, physical activity, and then the chronic infection. So which leads to what happened? These are the causes. If you see, the result leads to it can be what do you say cause type 2 diabetes, NAFLD will be there, of a non-alcoholic fatty liver disease and cardiovascular disease. cardiovascular disease. It can also induce the cancer, and then the depression, autoimmune disorders, neurodegenerative disease, sarcopenia, osteoporosis, and immunosenescence also will be happening. So that's why if you are having sedentary lifestyle, you should change it, because otherwise it can induce these kind of effective. And if you see in the shift in the inflammatory response from the short to the long lived, that's a chronic, can cause a breakdown of the immune tolerance, and then the result to the major alteration in the all tissues and in the organs, result to major alteration normal cellular physiology, and it result to the impairment of the normal immune function and leading to the increased susceptibility to infections, tumors, and then the poor response to vaccines. And this is the one model. If you have any kind of chronic disease, this onset, whenever the onset of the chronic disease is there, the pro-inflammatory environment or the pro-inflammatory cytokines will synthesize more in the extracellular. In the intracellular, there is a p-stat protein will be there, that also increase, and fold change of response will be decreased, and then the cellular output will be more reduced or altered, that is also decreasing, and immune system will not function effectively, that also decreasing, and unhealthy, which is cardiovascular aging, that is also increasing. So that's why this can lead, can come, or it can caused by the inflammatory response as well, which can be multiple possibility. For example, impure air, or the uh, induced stress that you are having due to your lifestyle, and then the food habits, those kind of things also can happen, this kind of things. And this shifts in the inflammatory response from the short to living can cause increased risk of the various non-communicable disease. That's what we have seen with like irrespective of age, that is can be young or the older individuals, and during the pregnancy and then the childhood can have the serious developmental consequence that include elevating the risk of non-communicable diseases over the lifespan. So that is what we are seeing. So the maternal exposomes and low-grade systematic chronic inflammation can affect the child as well as the mother as well. Okay. So next we are going to see what are the therapies are there in this case of the cytokine. So cytokine can be used for the therapies as well, because there are certain individuals, they don't secrete, or they don't secrete enough to do these things. And cytokine based therapy is if someone is having more active uh, inflammatory response, then that should be stopped. So in that case, we will give the monoclonal antibodies. Monoclonal antibodies is nothing but that both the arms of an immunoglobulin will have the single paratope against one single region of the epitope of the antigen. Okay. So this monoclonal based or monoclonal antibody based therapy is also there. So that since 1980s, due to this genetic engineering, you people should have studied. We can clone any gene into the desired vector, then we can express it in the mammalian system, or bacterial system, or yeast system. Then we can isolate the or purify the protein of interest. So one such great example that we know is insulin. Okay. So, what are the different diseases can be cured in this case? One is the hepatitis B and C, along with the ribavirin, and then hairy cell leukemia, which is called A type of B cell leukemia, and then chronic myelogenous leukemia, that is called CML, which is the case that increased number in granulocytes, and the Kaposi sarcoma. This usually happens in the HIV positive individuals who has AIDS stage, and multiple sclerosis, which we know that it is also a cancer. So young adults are the primary target of this autoimmune neurological disease. And interference in treatment, others also, this follicular non-Hodgkin lymphoma, cutaneous T-cell lymphoma, multiple myeloma, hereditary immunodeficiency, chronic uh, granulomatous disease that we have seen CGD in the last week, and osteopetrosis. Osteopetrosis is quite different, which is a life-threatening situation where overgrowth of the bone will happen. When the bone is growing so much in the wild, then what will happen? the tissue damage will be there, and then the vessel blood vessel thinning will be there, thinning. Then the construction of the vessels will be there. So that also related to blindness as well as the deafness. So what are the therapies are in the case? So people have used some agent, that is roferon, which is a natural agent of interferon 2A, that helps in the hepatitis B, hairy cell leukemia, Kaposi sarcoma, and then the hepatitis C. And Intron A, which is the brand name, and then which is having the interferon alpha 2B, which helps in the melanoma cases. In multiple sclerosis, people are using beta seron, which is a interferon beta 1B, and the Abonex, which is a interferon beta 1A, that is used in the multiple sclerosis case. And active immune, which is the interferon gamma 1 beta segment, and that helped in the CGD or the osteopetrosis case. And what are the side effects of this interferons in the treatment? You will, if you treat more, then it will give the flu-like symptoms, chillness, fever, headache, fatigue, loss of appetite, and then the nausea also will be there in the patient. And then there will be low white blood cell counts, or they will be anemic if you give prolonged this kind of treatment. And then the skin rashes will be there, thinning of hair will be there. These side effects can be severe and can make the treatment with interferon hard for the many people to tolerate. And then most side effects do not last long after the treatment stop, but fatigue can last longer. So other rare long-term effects include damage to the nerves, including those in the brain as well as in the spinal cord. So then they can't think properly, they cannot sleep properly. So these are the problems of this interferon treatment. So there are interferon inflammation blockers as well. So how we can block? By removing or sequestering the inflammatory cytokine, or by blocking the target receptors of the inflammatory cytokine expressed over the target cells. So this should be the whatever the blocking agents we are giving. It should be biocompatible molecules. With these properties can be used for the damping the inflammation. So one such example, if you see the soluble TNF alpha receptor, that is Enbrel, what will happen? This monoclonal antibodies, which is against TNF alpha, that is Remicade and then Humiria, can be used in the treatment of rheumatoid arthritis. So this goes and binds to this TNF alpha receptor. So whenever this is happening, this monoclonal antibody we give, then it will not allow the TNF alpha to function. So this also helps in the ankylosing spondylitis. Okay. And another example, if you see the recombinant form of IL-1 RA receptor antagonist, that is called anakinra. So that is also reduces the inflammation, joint pain, joint swelling, and then caused by the moderate to severe active rheumatoid arthritis. So another thing is the monoclonal antibodies directed against the alpha chain of the IL-2 receptor. So that is these two drugs are used in this case. And these people usually use it in the case of prevention of the transplant rejection, because whenever the transplant organ is there, our body can sense it as a non-self, then it will be eliminated. So to stop that thing, we have to keep our immune system in a inactive state. So that's why these monoclonal antibodies will be used for IL-2R, that will prevent the transplant rejection. So these are the list of things are there. You can go back and then read this whenever you are having time. So that we have seen this list already. So Enbrel will be used in the rheumatoid arthritis, and the Remicade also used in the rheumatoid arthritis, and then the Crohn's disease, which is related to the bowel segment disorders, and Neo4gene also, which is having GCSF, and that stimulates the production of neutrophils, reduction of infection in cancer patients treated with chemotherapy as well as in the AIDS patients. Leukin will be there, that is nothing but the GM-CSF, that helps in the production of the myeloid cells after the bone marrow transplantation. And then Numega will be there, that is IL-11, that stimulates the production of the platelets, an apogen, that is erythropoietin, which helps in the red blood cell production, and this Kineret is there, which is a recombinant IL-1 RA, that helps in the rheumatoid arthritis, And the Xenapax, it's a humanized monoclonal antibody against IL-2R that prevents the rejection after transplantation. Then the Simulect, which is a human or mouse chimeric monoclonal antibody against IL-2R that prevents the transplant rejection. And what are the side effects of this cytokines therapy? That is the damping the suppressing the cytokine activity. Example TNF alpha activity repressor, and then the enhanced risk of infection as well as the malignancy. It can induce the lymphoma, and the side effects are unpredictable in certain cases. So the recombinant IL-2 can cause the mild symptoms, which is the example fever, chillness, diarrhea, weight gain. To the serious things, anemic if that patient can be, and then thrombocytopenia, shock, respiratory distress, or the abnormal heartbeat or chest pain, and then the other heartbeat also will be there. So, what is the technical challenge in the cytokine therapy usually? That are high local concentration of this extremely potent cytokines will be there, and the cytokines are very very short half lives. What is in the case of recombinant human IL-2 has only 7 to 10 minutes of working concentration. So this is also an issue for this thing. And finally, we have seen in the last week that I have missed this slide. So if you add certain reagents in the PBMC things, then that will become certain other cells. For example, if you add granulocyte macrophage colony stimulating factor, that will induce the dendritic cells. And if you add macrophage colony stimulating factor, that will become macrophage. And if you add FLT3 ligand, then it will become PDCs. So this is what we have forgot to talk in the last week. And I think that's what I have. Can we move on to the questions, or you have any doubt in any topic? Can we start the question and answer session?
Yeah, yes, sir.
Okay. The first question: which of the following is not a characteristic property of cytokine? A. Synergy, redundancy, pleiotrophy, amplification, and cascade induction. Which one is not? What's the answer? You can use the chat box also. Which of the following is not a characteristics property of cytokine? Tell me. The people are there. Yeah, tell me what is the answer? Which of the following is not a characteristics property of cytokine? Synergy, redundancy, pleiotrophy, amplification, or cascade induction? Which one is the answer?
Amplification.
Yes, amplification is not the property because synergy means two cytokines will do the one function for the one cell. Redundancy means multiple things A, B, C will do the same function for one cell. Pleiotrophy means one cytokine will act on multiple cells. Cascade induction means A cell will secrete one and it will act on B cell, and B cell will secrete another, then it will go to the C cell. So that's why it's a cascade induction. So the answer is amplification, which is not the property of cytokine. Okay. Second question: which of the following is not a function of cytokine? Which of the following is not a function of cytokine?
Oxygen transport.
Yes, oxygen transport is done by oxygen transport. Which cell will do?
Red blood cells.
Hemo, hemoglobin will do the oxygen transfer, which means that is not the correct answer. So what they are saying, cell proliferation, yes, there are certain cells will get proliferated due to the cytokine. Immune cell recruitment, yes, that we have seen some leukocyte chemotretin factors as well, that is MCF. And cell death inhibition also will happen, and inflammation regulation also happens by cytokine. So when the odd one out is oxygen transport. Okay. If the secreted cytokine has to travel through blood vessel to reach its target and exert its function, it is autocrine, paracrine, endocrine, allocrine, or none of the above. Which one is the correct answer?
None of the above.
No, it's a endocrine. The reason I said na, it will be secreted somewhere through blood vessels. It will go. then it will go and act on. So that's the first thing that we talked about in the mode of action. Autocrine means one cell will produce something that will act on the same cell. Paracrine means neighboring cell. It will secrete, A cell will secrete something that will go and hit the B cell. But here, what is the question? Travel through blood vessels to reach its target and exert its effect. So that is called endocrine. Okay. What is the true statement about which is a true statement about cytokines? They are high molecular weight proteins. Is it a correct statement or a true
No, sir.
statement? No, sir. Why? They are low molecular weight proteins. Okay, secreted by the RBCs. Is it correct?
No, sir.
No, sir. No. Why? It's secreted by
By WB.
WBC. Yes. Which this is long lived and months to years. Is it correct? Cytokines long lived.
No.
No, because it lived short, hours to days. Regulate the intensity and duration of the immune response. Is it correct?
Correct, sir.
Correct. It is correct because all of the above will not come because multiple things are wrong. Okay. Which of the following is a 9 amino acid molecule plays an important function in the blood pressure regulation? Thromboxane, bradykinin, insulin, serotonin, and prostaglandin. Which one is the correct answer? Which of the following is a 9 amino acid molecule plays an important role function in blood pressure regulation? Any idea? We have talked about one thing. It's a 9 amino acid peptide I told. Any idea? You tell me one thing, then I will. Anyhow, I will tell the correct answer. Na? Which one is the correct answer? Here. The answer is bradykinin, which is a 9 amino acid peptide. So that helps in the blood pressure regulation. Okay. Sixth question. Which of the following is not a cardinal sign for acute inflammation? Which one is not? Redness, swelling,
Humor
pain,
swelling.
heat. It's not a cause you are saying. You're going by cycle and you fell down. Won't your leg will swollen the moment you fell down?
Anesthesia.
Anesthesia. Yes, the answer is anesthesia, numbness. Because you will be having much pain. So redness will be there. Yes, correct. Swelling will be there. Yes. Pain will be there. Yes. Heat will be there. Yes. Numbness will not be there in the case of acute inflammation. Okay, this we have seen. Aspirin and then ibuprofen works by inhibiting the action of. This I have talked. These are non-steroidal anti-inflammatory drugs. We call it as NSAIDs, which is inhibiting the action of what?
Cyclogen.
Cyclooxygenase. Yes, that's the correct option. Okay, which of the following properties of cytokines is are correct? Which among the following properties? Okay, any of first one is correct or what? Which is high molecular weight protein. That is correct or wrong? Just now we have seen.
No, sir.
Cytokines are?
It's low molecular weight.
Yes, it's a low molecular weight. Secreted by WBC in response to intrinsic and extrinsic stimuli. Is it
Yes,
correct?
sir.
Yes. Third one is correct or wrong? Cytokines action is long lived,
No, sir.
generally ranging from. Yes, it's wrong. So only option 2 is correct. Which of the following functions of cytokine is are correct? Development of cellular and humoral immune response. Is it correct?
Correct.
Correct. Yes. Reduction of the inflammatory response and healing of wounds, they say. They say reduction. Is it correct? Cytokines will reduce the inflammatory response or what? And healing of wounds. No, right? It will induce the inflammatory response. So, which is not correct. Control of cellular proliferation and differentiation. Is it correct or wrong?
Correct.
Correct. Yes. So 1 and 3 are correct. Which of the following statements regarding serotonin is are correct? Okay. Serotonin regulates the inflammation by acting on serotonin receptors that are differentially expressed on non-immune cells they have given. Is it a correct statement? Correct or wrong? Correct or incorrect?
Incorrect.
Incorrect. Why? Which statement is wrong in that? Which word is wrong?
Does not regulate
Does not
inflammation.
regulate inflammation. No, no, no. It regulates inflammation, but it will be differently expressed on immune cells. They have regulated non-immune
Sir,
cells.
immune cell.
Okay. Yes. So this is the wrong statement. Serotonin acts as a potent chemoattractant, recruiting innate immune cells to the site of inflammation. Is it correct or wrong?
Correct, sir.
The correct statement. Okay. Immune cells have a high capacity to synthesize and release serotonin. Right or
Sir.
wrong? Correct. So 2 and 3 are correct. I think that's what I have for the day. If you have anything, then we can talk. So, if I want to recap everything, so we have started with the week 4 concepts. So, we started with cytokines, how different immune cells are secreting cytokines, and then what are their effect and how they show their effect we have seen, and what are the non-immune cells secrete these cytokines, then what are the properties of cytokines we have seen, and then the cytokine action, that 5 different action including pleiotrophy, redundancy, synergy, antagonism, and then the cascade that we have seen, and then the what are the nomenclature of cytokines based upon their secreting site, and then the cytokine types, and then the if it is involved in the innate immunity or the adaptive immunity, those kind of things that we have seen today, and what are the other immune mediators such as serotonin, and then the histamine that we have seen, and eicosanoids also we have seen, and then the drug aspirin, and then ibuprofen we have seen, then other immune mediators like bradykinin, interferons, so far we have seen, then inflammation, how it is happening, how inflammation outcomes will come in the body, and what are the two different scientists they have talked about the inflammation, and what are the signs of inflammation that we have seen, and if the inflammation is happening, how it is happening, those things we have seen, and what is the homeostasis between the inflammation and then the disease, as well as the inflammatory state that we have seen, and the cause, and then the impact, and then the pathological outcome of the inflammation we have seen, and what is the sterile inflammation, and what is the different types of low inflammatory as well as the anti-inflammatory that we have seen, and how the pain is generated we have seen, and then the what is the difference between acute as well as the chronic inflammation, and what is the consequence of this chronic inflammation, and those things we have seen today, and what are the cytokine based therapy and interferon therapy we have seen, and then the other inflammatory blockers that we have seen overall, and finally what are the challenges of in the cytokine therapy. So this is the recap we have, and this is what we have seen in the last 1 hour of the 1.5 hour of the class. So do you have any doubts or something we can discuss?
Same.
Yeah, tell me,
Sir,
Ashwini.
last week you said about the internship, sir.
Yes,
ICMR tuberculosis in industry, sir.
yes, yes,
Sir,
yes.
we asked permission in our college, sir.
Okay.
They told to apply and use that opportunity, sir. Then how
Yes.
I will apply, sir?
So actually, you have to write a letter through your
Okay,
HOD
sir.
to the director of that institute, tuberculosis
Okay,
institute.
sir.
Then that letter will reach them. You can mail them also. Your HOD should mail, not
Okay,
you.
sir.
Okay. He or she should mail, and then they will reply within 30 days or something. They'll reply because you want to go it in the month of May,
Yes,
right?
sir.
So now you apply.
Okay, sir.
Then it will be good.
It,
It will take some time
if
for
there
them
is
to.
any inline for that, sir.
Which one, ma'am?
Inline, TCMR, ICMR, sir.
Yes.
Inline,
Inline in the sense?
this is the last date for the apply, like that.
No, 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 no.
Okay.
It's a application based. So you are
Uh,
applying. They will tell you.
okay, sir. So stipend,
This week I have
any
seen.
availability, sir? Stipend about.
I don't think so. I say they are giving any stipend. And recently I have seen two or three
Okay,
internships.
sir.
Please wait. I will tell you. I have it.
Okay.
Wait. Yeah. First one is summer training program by ICMR NIRRCH. Okay, I will tell you first one. First one is IIT Hyderabad. Okay,
Okay, sir.
that is giving first year MSc students. They are giving with the fellowship, with the stipend. They are giving.
Sorry,
IIT Hyderabad.
Hyderabad is too long, sir. That you said
Okay.
Chennai TAFR Institute for
TAFR is not in Hyderabad. No, it's in Bang. It's in Hyderabad.
Okay, sir.
But one more thing is there. That is IIT Madras. Okay, IIT Madras is Chennai only, na?
Yeah, yes, sir.
Yes. So that is having the summer fellowship program.
Okay, sir.
It started already. You can go back and then see the. Am I audible?
It's sir, audible, sir.
Oh, yeah. So yeah. So IIT Madras is having that one. So you can go back and then see. The last date is. I'll tell you.
Okay, sir.
Write it down. IIT Madras Summer Fellowship Program.
Okay, sir.
So they are giving stipend 15,000 per month.
Okay, sir.
Okay. And they have given the details also. You can go back. Last date is 28th February 2025.
Okay, sir.
So the portal is already active. You can do it. And other one is Summer Research Training Program at ICMR NIRRCH. I don't know where it is.
Okay, sir.
Any of you don't want to go outside Tamil Nadu, so you subscribe this one this Biotechnica. Daily you will get mail actually. Daily or 2 days once you will get it. Have you done it?
No, sir.
Yeah, do that thing because that will help you to see what are they. It will mail only. It will come. I also get it from them only.
Yeah, okay, sir.
Yeah. But I will tell you one example. If you are some of you are want to go, IIT Hyderabad is there na. They have 250 slots. Okay, 250 people they are taking.
Yeah,
In that 100 people are they are taking only girls.
yeah, okay, okay, sir. But
So there will be huge chance that they will accept. And they said everything is free if I'm not wrong.
okay, sir.
IIT Hyderabad.
Oh,
Yeah, I will read out that thing. They said food they will food actually you have to pay, but academic wait. Last date is 5th March. Okay,
okay, sir.
and what they have mentioned, they'll give you accommodation and everything. Actually,
TAFR, sir.
no, no, no. This is IIT Hyderabad.
IIT Hyderabad. Okay, sir.
Yes, IIT Hyderabad. Yeah, they have given C. Number of intake is total 250 interns, 100 exclusively for girls.
Yeah, yes, sir. Sir, any
So 15,000 per intern they are giving altogether for 2 months.
sir interview based.
Nothing interview based. It's application based actually.
Yeah, okay, sir.
Someone should give you the recommendations. All those things will be there. and you can do it minimum 1 month or 2 months. You can go do from month of May to July.
Yeah, okay, sir.
Yeah, they have mentioned hostel accommodation provided in IIT Hyderabad student hostels. They are mentioning.
Okay, sir.
So you can apply because 100 slots are there now for girls. So there is a huge chance that
Yeah, yes, sir, yes, sir.
they might take you.
Yes, sir.
Yeah. So don't leave that opportunity.
Okay, sir.
And they're giving money also. See, suppose your parents are paying first
Sir.
month your this one, what we say, mess bill. But the second month onwards, then you can pay it now because your salary will come 7,500.
Yeah, okay, sir.
Yeah, so it will be a good opportunity. Please make use of it.
Okay, sir.
So I'll do one thing. Maybe whenever I'm getting mail, I will keep it ready, and with my presentation, I will keep it. Along with that, I will upload it. Then you can read those
Okay,
things.
sir.
Yeah, understood. I think Sajal, first time you have joined, if I'm not wrong. Can you please introduce yourself? You can use the chat box as well if you want to talk. Sajal, are you there? Okay. Okay, do you have any other questions or else we can wind up the session for the day?
No, sir.
Okay. Okay, then you can leave.
Okay, sir. Thank you, sir.
Yeah, no
Good
mention.
night, sir.
Good night.